It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In the last blog I shared, palliative care hospitalizations are rising for Australians at the end of life. You can check out the last blog by clicking on the link below this video. In this week's blog, I want to share what would happen if long-term ventilated adults and children in intensive care and their families would design care. Well, it never ceases to amaze me how non-intuitive care is for long-term ventilated adults and children in intensive care or pediatric intensive care. Patients and their families are stuck in intensive care for many weeks or months, sometimes even years, in one case in New Zealand, Auckland, and without given the opportunities to leave intensive care and go home. Or even worse, they are told that a withdrawal of treatment or a limitation of treatment might be, quote-unquote, in the best interest of their loved one. No matter where you or your loved one is in a situation in intensive care where you need ventilation support with a tracheostomy or via CPAP or a BiPAP mask, the reality is that you have the option to look forward to, even if intensive care teams think you or your loved one has few or no perceived options. For example, our service at Intensive Care at Home can provide you with choice and options like up to 24/7 ventilator weaning at home with critical care nursing staff as a genuine alternative to a long-term stay in intensive care. We can also provide up to 24/7 palliative care at home with critical care and ICU nursing staff as a genuine alternative, again, to a stay in intensive care. We can also provide up to 24/7 support with ICU nursing staff if you or your family member needs ongoing or intermittent ventilation with tracheostomy or CPAP BiPAP mask long term. And we can provide TPN, total parenteral nutrition administration, via PIC line or central line in the community, as well as home IV antibiotics. This also provides a great opportunity for intensive care units to free up their precious beds, staff and other resources, and they can focus on more acutely unwell patients, which is what they do best. What we do best is to look after long-term intensive care patients depending on life support at home, and we do it in a holistic and family-friendly and patient-friendly home care environment. This also provides a fantastic opportunity to save up to 50% of the cost for intensive care units. Therefore, we create win-win situations. And this is what patients and families want. They don't want to be in intensive care for longer than necessary. They simply want to be in an environment that's more patient and family friendly, period. Intensive Care at Home has designed that environment to improve quality of life and quality of end of life. Therefore, if you are in intensive care long term, or if you have a family member in intensive care long term, let us know. Get in contact with us and we create the environment for you that is most conducive to your situation. And if you're watching this as a health professional in intensive care and you know that patients and their families are much better off at home, go and contact us today and we'll make sure you have a cost-effective, quality alternative to free up your precious, expensive and in-demand intensive care beds. So if you want to find out how we can help you get your loved one out of intensive care, including palliative care or long-term acute care, also nursing homes, or if you find that you have insufficient support for your loved one at home on a ventilator, go and contact us on one of the numbers on the top of the website. You may also want to look at our career section. We are currently hiring intensive care and pediatric intensive care nurses for clients in Melbourne, Sunbury and in South Gippsland in Victoria. We are also an NDIS, TAC and DVA approved community service provider in Australia. We have also been part of the Royal Melbourne Health Accelerator program earlier this year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.